Welcome back for another evening of Halacha and Medicine. We're just 1 week away from Leil Seder. There are many different topics that are prevalent with regards to medication, as well as being able to the different chiyuvim, and they stretch all the way to those who are going to be in a facility or with a loved one, how to be able to the various halachos, and we hope to get through many different topics tonight. We're very fortunate to have with us HaRav Moshe Plutchok, who is the Marda Asra of the Kashrus in Cedarhurst, as well as one of the Rosh Yeshiva and Yeshivas Dar Chaim in Borough Park. We would like to thank as well the sponsor for tonight, JOWMA, the Jewish Orthodox Women's Medical Association, who provides free health education to the entire Jewish community and support a network of current and future Jewish female physician leaders. Once again, it's a big zchus to have everyone here, for people to take the time out of their very busy schedules. We know there's so many other things that need tending to. So please enjoy this shiur, and we hope to as well share it on various chats with links. Have a Kashrus Sameach.
Hi, thank you so much for inviting me. I would like to address I think it was about 4 discussion points that Rav Moshe asked me to talk about. Ironically, I noticed that they stack up in the Shulchan Aruch very evenly. The first one in the order of discussion points would be Bedikas for hospital rooms in Siman Tuf Lamed Beis. Medicines would be in Tuf Mem Beis. The discussion of Matza Shira, which is egg matzah, is in Tuf Samach Beis. And grape juice and shiurim would be in Tuf Ayin Beis. Doctors like mnemonic devices. Every one of these is with a Beis. Lamed Beis, Mem Beis, Samach Beis, and Ayin Beis. It's just easier to remember. Now, we'll do first, even though the medication discussion takes more time, and it's something that I think is probably more important for different practitioners, but the Bedikas is a situation which many people find that they have certain questions about. I'll spend a few minutes on that. The halacha is everybody has to check their house Erev Pesach, Yudalid. The Bedikas has to be done with a bracha. Obviously, if somebody is in the hospital, so that room has to be checked also. Most of the people that are in the hospital are not in a matzav, they're not in a frame which would allow them to check their rooms. So if they're able to, what they do is they appoint a shaliach. The shaliach makes the bracha for them. They don't make the bracha. The shaliach makes the bracha for them. If they're not able to, meaning they're not awake, they're not compos mentis, whatever the situation might be, the right thing is for a person to appoint themselves as a shaliach and to check their room. In that case, they could also make a bracha, because we would see them as partial owner of the room. The house of the choile also has to be checked, and again, the choile should appoint the Bedikas as a shaliach, and the Bedikas will make a bracha, check the house. You could then ride to the hospital, check the room, and that would all be under the purview of the initial bracha that was made. But again, there is an obligation. The room has to be checked and has to have all Chometz taken out of it. And as far as a bracha, if the bracha is forgotten, still the Bedikas should be done. That's as far as Tuf Lamed Beis. Again, if a person finds themselves in a hospital in the middle of Pesach, so then again, a bracha and a Bedikas has to be made. The choile should make a shaliach, or the choile, if they can't make a shaliach, the shaliach should appoint themselves, and they should check the room. Till the end of Pesach, a Bedikas has to be made. Every place that we go on vacation, if we go in the middle of Yontif, we have to check. We have to do a Bedikas and make sure that that space that we're going to occupy is free of Chometz. This is the halacha. Now moving on to Tuf Mem Beis. You have any questions about this?
No.
Okay.
The sidebar, someone asked why do you have to check if you're not renting it, it's not your place.
Again,
because you have access to.
First of all, you are renting it. The fee that a person pays for hospitalization is more than a rental fee. Now, it's true that the hospital can move a person from room to room, and it's true that your rights are limited. But still, this is an area that the sick person, is renting till they convalesce, till they get better. Just because the landlord has a draconian set of rules that allow him to move anybody to where they want to, doesn't mean it's not a rental. It could be, an argument could be made that no kinyanim were established, but still, the right thing is to make a bedika, and the place can do say with a bracha. Okay. So moving on to tough mem beis. Now, I'm gonna explain that products, medications, vitamins, different fortifying agents. A person could spend a whole year learning and discussing this sugya. It's a very big sugya. I'm going to try, with a limited amount of time, to give the tent poles of this halachic tent and to try to get as much in terms of yesodis that allow a person to come to their own havana and conclusion. For the most part, once chometz is inedible by a dog, which most medications are, if it was turned inedible before Pesach, it's not considered chometz. And there are no medications that are edible. Their active ingredients are certainly inedible. And even if they have a coating, for example, it's known to people that Advil has, depending on the batch, it has different types of coating. They always taste the same, but sometimes they're just a glaze of sugar. Other times they're a glaze of sugar with shellac. Shellac comes from a bug. It comes from the lac bug. There might be a Kashrus problem. Poskim seem to have accepted that Advil is kosher. It's kosher for Pesach also. But that's one of the few medications that have actually a sweetness on its exterior. For the most part, almost all medications, pills, swallowables, even things that have gel caps have no taste or even a bad taste. So really, everything should be mutter. There should be no chometz problem. Definitely to keep it in your medicine chests and cabinets and not to lock it up is mutter. There is a tzad to say that you're also allowed to use these products on Pesach. I want to go into why some say not and some say yes. I'll explain how chomer a lot of these things are with a few examples. About 40 years ago, maybe 50 years ago, it was learned that there were some bread companies, bakeries, who after making bread have a tremendous amount of carbon dioxide. The bread, as it puffs up, lets out these gas plumes, which is what makes the bread bready, what makes the bread spongy. And some companies learned how to harness that carbon and sell it to seltzer companies. The reason they learned how to do that is because there was a carbon tax that prevented them from allowing this carbon to just go out in the air. So they had to harness it, they had to collect it, and once they collected it, they realized they could pass off the cost of collection to another company who would be eager to buy it. Those were seltzer companies. So now, what entered into the halachic framework was a very big problem of chometz in your seltzer. Nobody would have imagined that the carbon bubbles in the seltzer could possibly be chometz. And there were some poskim that held that you could not buy seltzer unless you have a kosher Pesach symbol. This was many years ago. Reb Shlomo Zalman said, no, at the point where it becomes carbon, it's not chometz. I don't know that his position is so understandable, but it's something that everybody seems to accept. We don't really look for, I'm saying kosher Pesach on seltzer is just a hidur, but for the most part, everybody seemed to have accepted Reb Shlomo Zalman's psak, that once it's transformed to carbon, there's no problem of chometz. Chometz is only tangible, something food. Transformed to gas is not chometz. But what I'm trying to show is that in the least expected spots, a person could find the problem of chimutz. In the least expected areas. There are many examples of this. There are many cases like this. So I think it's important to understand what is asr and what isn't asr. For example, one more quick example was during the time of the Divrei Malkiel, about 120 years ago. There was a question about perfumes. This question filters down all the way to today's Paiskim, where some hold perfumes, shampoos that have an alcohol base are not mutter on Pesach. Why? Because it was discovered that people that were addicted to alcohol knew how to freeze the shampoo or the perfume and to create a division between the alcohol and take that alcohol and drink it. And therefore, even though on the face of it, it seems like it's not at all roi la'achilas keleb, seems like a dog would never eat it, and truly a dog would never eat it, but it could easily be separated chemically, and then somebody would drink it. So in this form, in the form that comes to us as consumers, it's not at all roi for anything. Many poskim relied on the fact that what it is now is not roi, and therefore we go with that. And that seems to be the halachic approach today. Most people don't go through their shampoos and soaps and look to see ingredients. Even Aveeno and the Aveeno products, which have oatmeal in it, seem to be okay, because what we understand is it's not at all fit for a dog. There is no dog that would eat this. Even the hungriest of dogs would not eat this. And therefore it's not roi and it's acceptable. But again, the point I'm making is that the shaila, which was developed, was not because it presented as edible, was because there was a chemical way, or not even chemical, there was a methodological way of separating the alcohol from the product, and therefore the Divrei Malkiel, who was a very big Pesach 100 years ago, I think he died in 1909, was convinced that it should be asr.
So to just interject for a second, so that means these Pesach lists and other things that have the listings of these Aveeno and other items, one can feel comfortable in being somach on the Mekilim, not to necessarily get rid of these items?
Yeah, listen, my Meserah is from Rav Chaim Pinchas Scheinberg, my father's Zatzal. Used to ask him these shilas, and yeah, he didn't feel that a person, if you know clearly that something is a wheat-based product, he felt you should put it away. Like an Aveeno oatmeal bath. You see the oats there. So it's mixed with a little bit of perfume and some sort of a soap. You see the oats there, he felt to put that away. But there are poskim that are comfortable not putting that away, because I'll explain another reason why there are poskim comfortable not putting it away. Now again, if you want to be machmer, everybody knows there's a beautiful Arizal who says somebody who's nizer and is careful not to have even a mashu of Chometz, and technically that means with all the chumras and with all the hidurim, well, he's muftach that he won't sin a whole year. That's a very nice promise and a very wonderful guarantee from one of our biggest people in history. So it is a nice thing, but again, you have to differentiate between what's halachically required, mandated, and between what's a very nice hidur. These are nice hidurim. There is a concept of toch v'yichada. I want to explain that for a second. It also has to do with medications, with shampoos, with if a person has a big piece of dough and he decides it's a nice piece of dough, rather than make it into bread, he'll put some glaze on it and he'll designate it as a stool, as an ottoman. Now, technically, dried dough could be eaten. You could scrape off the glaze and you could just eat the dry dough and it's edible. But once a person is toch, he does two actions, two processes. Toch is he does something that designates this item to not be food. He turns it from a food item to now functional. It's a utility item. Toch and yichada, he has in mind to use this as a chair. It's not chometz anymore. We see this now. I'll give you a practical application of this case. When I was young, a neighbor of mine asked me to go into their house and feed their goldfish on Pesach. They were going away. They asked me to go into the house and feed their goldfish on Pesach. Now, the food I noticed was chometz. I looked at the ingredients and there were breadcrumbs in it. So I did not feed the goldfish with breadcrumbs. You're not allowed to. I brought up matza meal and I substituted it. By the end of Pesach, all the fish were doing the backstroke. Unfortunately, I did. But walking out of the guy's house, what I noticed was that he had a mezuzah on his door, and it was made with macaroni strings. That means it was long spaghetti strings that were turned into a mezuzah holder. His kid must have made it, and he used this as a mezuzah holder. And I thought, oh wow, this is chometz. Being a machmer, at that point I didn't know better. I took the mezuzah holder off, and I burnt it, and I replaced it with another. I replaced it with my own, mezuzah. He came home. He wasn't upset, not about the fish or the mezuzah cases, but I had questions whether what I did was right. Now with the fish, yeah, what I did was right. I can't feed chometz to fish, but with the mezuzah case, I was wrong, because the fact is that even though it was macaroni, but he did paint it with a nice bright yellow paint, so it becomes now a mezuzah case. It's not considered chometz anymore, even though a person starving could easily wash off the glaze and boil it and create good food out of it. Doesn't matter. That's toch v'yichada. A lot of the shampoos and all the products that we might introduce on Pesach are also in the category of toch v'yichada, and therefore they're not considered problematic. And that's why some poskim would hold that the Avino bath could be just, left on the shelf. Of course, you shouldn't. Some poskim even think you could use it. I wouldn't be comfortable using it, but the shampoos that have like wheat germ in it and different wheat, my father's Rosh Yeshiva Zatzal said we could use it, and he wasn't worried about it. That's the concept of toch v'yichada.
If there's a cream or some type of salve that is medication oriented, this person has a prescription for it, do they even need to look into it? Or
so that I'm going to explain. Right. The creams, medications, and even some vitamins. For the most part, vitamins are not considered medicine. Vitamins are not things doctors prescribe. So vitamins are not seen as medicine, and therefore much stricter guidelines are applied to vitamins. I will just give the few besides. There's vitamin E that's prescribed by doctors, often for blood health, for clotting. There's vitamin B that's prescribed by doctors. I forgot what it's for. And then there's vitamin D for bone health. These are vitamins that, according to most medical practitioners, really work. And then there's folic acid for anemic pregnant ladies or for ladies that had babies. This is prescribed. There's also niacin that's prescribed, I think, for some sort of infirmity, for some sort of heart health. I'm not sure what it is. But these, I remember reading, are the vitamins that are considered medications. These are not considered vitamins anymore, even though they are an amino acid or a vitamin. But these specific vitamins from this group of effective vitamins, they're seen as medications. And all the dinim that apply to medications will apply to them. Now let me explain just a little bit of an outline of the medicine application. Meikar adin, like we started off, all the products and all the ingredients in these medications or vitamins are pasul me'achilas kelev. They're not worthy of being eaten by a dog, and it has to be like that before Pesach. Most of these items are produced before Pesach, and therefore it should be permissible totally to use these products. Now here's the problem. There is a concept called achshavei. This is something that was created by the Rosh in the second parak of Pesachim, right? The first Rosh in the second parak, and his understanding is how could you say it's not worthy of being eaten by a dog if you're eating it? If you're eating it, that's an indication that you hold it has value. That's an indication that you hold it's worthy of being consumed. Achshavei makes it that it now, not a dairaisa, but midrabanan, it becomes chometz. He infers that from a Gemara that says if you burnt your chometz before the time of the Isra Achilas chometz, you're allowed to have hana from it. You're allowed to derive pleasure from the ash. You could use it as a growth fertilization. You could use it for something wound related. But he says the Gemara stipulates you could use it, but you can't eat it. He says, why does the Gemara not say you could eat it? You could even eat it. You could eat the ash if you so prefer. He says you're not allowed to eat it because eating it would turn it into something substantive. Your eating it would now create a chashivas for it, and therefore you can't eat it. Okay, saying that, we now learned a new concept of achshavei, so it would seem that none of these pills should be able to be taken. If we know that there's a weak binder in the pill, some of the pills need a stabilizer or a binder, Or we know there's like a microencapsulation and it could be made from a wheat product or starch, maybe. We should not be allowed to take them because achshavei. So to that, there's a very interesting disagreement amongst the poskim, whether generally, 99.99% of the time, the active ingredient in a medication is never chometz or kidneys. The problem that we might have with wheat or starches would be in the binder. But if, let's say, the active ingredient was chometz, you don't want this product because you like it or you want to eat it. The person who's taking this product, the pill, the vitamin, is only taking it because they need it medically. That's not considered achshavei. There is a very large body of poskim that hold that that's not considered achshavei. They understand this from din in Shulchan Aruch that refers to burnt rodent. There used to be a medication that called for burnt parts of a desiccated burnt rat, and the poskim quote a Shulchan Aruch that says it's mutter to eat that. It's mutter to take that. If a person, it was generally seen as a refuah for epilepsy, and it's mutter to eat that. Now, why is it mutter to eat that? Because the Ksav Sefer and others say because achshavei for refuah is not achshavei. That doesn't show any chashivas. The fact that a person needs to take something for his health, for his medical well-being, that doesn't indicate chashivas. Chashivas is only if a person is eating the food because he chooses to eat the food. That's achshavei. So in such a case, again, we would technically be able to be mater most or all medications. Then there's another kula, and that's from the Chazon Ish, who says that the active ingredient might be something you want. The active ingredient is something that you're machshav. But generally, the chometz problem is not in the active ingredient, like we already said. The chometz problem is in the binder, or in the coat, or in the microencapsulation. The chometz is never in the active ingredient. So in such a case, when you're eating something and you don't even have in mind that small minor ingredient, what you're mindful of is only the active ingredient, which is going to help a person get better. In that case, we don't say achshavei. So you start seeing the general approach in the poskim is that there is no real problem with medication. And you don't really have to look at the ingredients, because even if the ingredients, which it hardly ever is, was chometz, you don't really say achshavei when we're dealing with refuah. And when you're talking about side ingredients that are not part of the active structure of the medication, then you have another kula, which is the Chazon Ish, who says that achshavei on the side structure is really not a problem at all. So the outcome is that you really could be makel by all medications that are necessary. However, where it does become a problem, and I think this is important to understand, and at the risk of offending some of the practitioners that will think what I'm saying is wrong, but this is the general approach by the poskim, that when you're dealing with homeopathy or different drugs that are not medically proven, and a lot of the homeopathic drugs have an alcohol base, and those are not sincere medicines. You're dealing with a small amount of active ingredient to a dilution of over 1 million, and the base is much more problematic in such a case. And the same would be with vitamins that are not on the list that I mentioned, which is B, E, D, folic, and niacin. All the other vitamins, which again could be work, could be promote, could be help, but there isn't, they didn't rise to the level of medication. And therefore all these things are sort of by choice. If a person wants them and the medical practitioner advises them to take them, those have to be vetted. You have to make sure that they don't have chometz in them in the homeopathic drugs. There are a lot of them that seem to have starch, that seem to have alcohol as a base, and you can't blanketly say that those are drugs that can be taken. And the same with vitamins. The heter that we're talking about is strictly for medications that are necessary. I will point out that sometimes people who are diabetic take glucose tablets. Those are necessary, and anybody that's monitoring, for sure, young diabetics doesn't want to play around with their blood sugar. Bemis, it's mutter. But again, the poskim do recommend that in order to modulate the sugar, they could often replace it with fruit juices, and they don't have to use the glucose tablets, which are kidneys. They do have cornstarch in them, most of them do. But if you know your patient and you realize that a deviation is going to create a problem, so then it's fine, because kidneys is okay for cholim. We, despite the fact that we took on a very big chumrah, Bnei Ashkenaz took on a very big chumrah, where we avoid all forms of kidneys, and over the course of time, we extended it more and more and more. But for cholim, we are mekel, and a diabetic is a cholim by every stretch. And therefore, if they need to take glucose tablets that dissolve on the tongue, it is mutter. Again, to encourage a diabetic to take orange juice or grape juice substitute would be a wonderful thing. But if you see that you can't, so leave the glucose. And the same would be with people struggling with mental health. It has to be understood that, yeah, it's true that depressions and SSRIs, you could look for kosher ones, but again, to play around with someone's balance could result in a terrible outcome. And again, those are seen as real medications by all the poskim, and one doesn't have to look for a replacement, nor should one advise someone to stop taking them, even if they know that the binder is a starch or the capsule is problematic. Mental health is considered a choila like all other cholim, and one should just continue taking the medication that they take.
So just a couple of questions let's get through. Just to be clear, would it be safe to say any medication or any vitamin that a provider prescribes is considered medication?
So again, it depends. That means if it's I hate to say it like this, but if it's a medical doctor who knows that a person has a certain deficiency and it's sort of lab tested, but you have sometimes people that have regimens of vitamins and minerals and amino acids, and it's whatever, it's fringe data. Mm-hmm. You can in good faith say that you could just avoid all Dinei, Pesach for that, because like by Shabbos, the concept of a kmiya, which is allowed to be carried on Shabbos, it has to be a kmiya shel mumcha. It has to be something that's proven. And the medical data is the most important proof. You can't have hearsay and testimonials and people that swear by a certain person if you do their vitamin. It's not acceptable. Halachically, it's not acceptable. Things that help people, psychologically, it's not acceptable. It's medical data that we rely on. Just like on Yom Kippur, you don't ask a homeopath or a Rav, you ask a doctor. Should this person eat or not? The doctor is the one that we rely on. Mm-hmm. Rabbanim are not doctors, but neither are fringe people doctors. Doctors are the ones that are kaiveya, and medical data is kaiveya. Again, the vitamins that made it out of the realm of vitamins into the realm of medicine is because there is real data that shows that they work. E works, B works, D works. People that take vitamin D
work.
Yeah, okay. Yeah. People that take vitamin D have a bone density that could be reflected in X-rays. You know what I'm saying? And folic acid works, and nice.
Let's say it's a multivitamin that they only need one or two components. Can they just be nechalin, or they have to find the isolate?
So that's a very good question. The multivitamin, there is a lot of information now that seems to say it's a life extender, and it again. To Miyosh Tev Al Tikri Ra would be nice to get like a Maxi Health multivitamin for Pesach, but if a person is away and they're taking it, they could rely on.
So prenatals also would be enough.
Yes, prenatals are definitely, yes.
Okay. Liquid medications that have flavor, do they have to
be checked.
They have to be checked.
Because then again, in that case, it's achila, it's derech achila. You'd be surprised that a lot of the most of the active ingredient, it's minor. Mm-hmm. It's not so simple that a choila by choice has a right to just take what he wants. So I think a very simple differentiation should be made between somebody who's post surgery and he's trying to adjust to getting all the anesthesia drugs out of him, and he needs regulators. Yeah, that would be okay. Mm-hmm. That would be okay, and you don't have to think twice. You don't have to tell the hospital to get a different product. But when you're dealing with people who are taking Ozempic and they need now regulation, well, they should try to find products. And
just to be mechalik, if someone's taking Ozempic because they're diabetic, or let's say
obviously, I'm sorry, okay. Obviously, I have to be clear. Ozempic, 99% of it is not being taken for diabetes, and even the few that are taking it for diabetes have a weight loss benefit that seems to be coming with it.
Let's say something like omega-3, fish oils, these types of things. These are all just where we put that in the medication box.
No, that's in the vitamin. Again, the cardiologists reluctantly, from what I see, look, I'm under the care of a cardiologist. They reluctantly allow you to take it if you mention it. Mm-hmm. They're not prescribing it. They're not.
Okay, we can feel free to continue.
Okay, so I'll just what's the matter? I'll just talk about salves and ointments. Those are even less problematic because you're not ingesting them. There is a discussion in the Poskim, the concept of sicha keshtia. There is a Mishnah Brura that would like you to use kosher soap. I remember that my father's Rosh Shiva of Chaim Pinchas Scheinberg, who was considered one of the biggest masmidim in the Dor. So he once told somebody, and I heard it. He didn't tell it to me, but I heard it. I was there as a kid. Somebody asked him, how come he uses ivory soap? Ivory soap is treif. It was at that point made out of animal fat, as a lot of soaps are, still today. And he said, I understand that there's a problem of sicha keshtia, and I understand that there are poskim that hold that you shouldn't use something treif on your skin because it's considered as if you're drinking. When you rub something on skin, it's as if you're drinking it. But he says, I also understand that ivory soap lathers quicker than any other soap. And I don't have time to wait for lather because I have to get in, get out, and go back to my svarim. So I saw clearly how much he was worried about this halacha of sicha kishtia. Now, obviously, on Pesach, there is a little bit of a bigger issue, but it also has to be remembered that once again, the Chazon Ish helps us, and he explains that this concept of sicha kishtia is only when you're dealing with a product that's edible, like a salve that's edible. Let's say you'd be using an oil, a wheat oil, if there is such a thing, or something that comes from Chometz, and then you have a problem that using this is as if you're drinking it. Yeah, that could be, and that would be a problem. But all our salves and all our ointments, they're not edible. They're not edible by anything. Not a dog, no one would eat them. And in that case, the Chazon Ish seems to hold like the Pri Chodesh, who holds that we don't say sicha kishtia in that situation. And therefore, salves and topical medications and eye drops and ear drops, those are all permissible without looking at ingredients. Just a footnote, when we were talking about the concept of toch v'yichada, and we mentioned the mezuzah case, in theory, that would also be why many people don't put Play-Doh away, even though they try not to use it on Pesach because it's really flour and water. But it is flour, water, salt, coloring, and some anti-clotting. It is edible because being that it's for kids, it has to be edible. So there are some books that say you have to put it away, it's Chometz, but we know it's not because it conforms to the same understanding that we said before, which is toch. Once you changed the dynamic and you turned it into a utility item and it's not a food item, or you were meyached it, you designated it by putting into those Play-Doh canisters. It was designated now as a toy. One does not have to put it away for Pesach. We are careful not to use it, definitely not to use it near food, just like a lot of products like Niagara starch and a lot of products we're careful not to use near food, but they're not problematic in any way.
One hour, someone wanted to know, and this is definitely a big sugya, so if we could just soundbite this. When does halacha look at something, when does something make the move from something that's anecdotal to empirical? Meaning, what are we relying on? We're relying on research, consensus of medical practitioners, meaning what's that hub of where we take our information from, as opposed to not?
That's a very good question. The person is asking, he's saying, listen, the data that this doctor or this professional collected shows that vitamin K works, and when a person has more clotting factor, they're healthier. And I do understand, and I do even agree that if a person has real data and it's not anecdotal, then they have a right to prescribe their patients their specific remedy, and they don't have to vet it by, the New England Journal or some British journal. They have a right to collect data and use that data as they feel. I do understand that. But again, it has to be data collection the way professionals understand. All I'm saying is it can't be anecdotal. It has to be done the way a study would be done. Do I have a definite cutoff for this? I mean, the Sugi and Shabbos in the 6th parak and the Shulchan Aruch and Siman Shin Aleph in Orach Chaim says it worked 3 times in 3 different situations. There's a formula that the Shulchan Aruch has. I don't think the medical world uses that formula. I think the formula used is much more complicated, and it's more rigorous. And I think that I think that if a person is really serious about data collection, look, when COVID started, so everybody was saying ivermectin. Now, I think that was permissible. I think a person wouldn't have to check whether. I think in that.
It was Pesach, yeah.
Yeah, I think in that situation there was nobody that's suspected that you have to check ivermectin, even though today maybe we would say you do. Who says that a horse dewormer works for COVID? But and maybe it does, maybe it doesn't. For example, there are certain lung cancers that ivermectin is being promoted on. It's fringe data, but I would say that it's mutter. I would say that when a person is dealing with, now again, the question is asking a very good question. What is it up to me to decide? No, it's not. But again, there is enough data that seem to have been promoted by oncologists that say ivermectin is seemingly showing some improvement in certain lung cancers to allow a chayla to take ivermectin, whether that's Chometz or not. But there has to be something along those lines. It can't just be anecdotal. Any doctor who has real data collection could decide for his chaylim that this is what they should do. Okay. We're going to move away from medication.
Yeah.
If they want to ask.
Okay, I'll store whatever. That's the end of the questions that came from medication.
Okay. So now, what did I say we were going to do next? Matza shira. Okay. So there's a difference between Sfardim and Ashkenazim regarding egg matzah. Ashkenazim do not use egg matzah unless a person is sick. Sick over here means, really sick, and it's very hard to find a person that needs egg matzah and would not be able to use regular matzah. So sometimes when you're dealing with people who are very appetite compromised and they need what they need specifically, and they're trying to build up calories, those are the people that we're talking about, and they would be permitted to use kosher Pesach egg matzah. Like the way there are a lot of Sfardim that don't use egg matzah today, but for example, people that are taking chemotherapies and are suffering with, feeling sick, and the doctors want them to build up an appetite, and they have to have more of a caloric intake. So yeah, those people for certain could use egg matzah.
Let's say children under, is there an age bar, or just keep it out of the house? It's not. Let's say a 3-year-old.
No, we don't take it in that. We don't
So
take
we treat
it
it like Chometz.
Ashkenazim do. Sephardim don't. Sephardim don't. You can find cookies that are made out of, Sephardim don't treat it like Chometz. Ashkenazim are circumspect with it. It's not. It's like kitnius. Again, kitnius is not Chometz, and kitnius is bottle. If some kitnius falls into a mixture, it's bottle. Unlike Chometz, which is not bottle. And kitnius pots, if you eat by a Sephardi and they're using their pots that they cooked rice in or beans in, you could eat their food. Even though most poskim say it would be preferable to wait till their pots are not a ben yaimai, till their pots are older than 24 hours. But really, if you're going to cause some discomfort, this happens when you're dealing with in-laws. Let's say a girl who's Sephardi marries an Ashkenazi and they go to their in-laws, and the in-laws say, we won't serve you kitnius, but the pots, the poskim say, Rabbi Yashiv says the pots are not a problem. In Shemaim they'll be fine. I think he says that. Somebody says in Shemaim they'll be fine. Better off if you don't offend your in-laws. Better off if you. So the egg matzah is seen the same way.
Liquid food supplementation, like Ensure, K Farms, etc. How much will we allow if a person needs the caloric intake? What's the barometer? Kidneys is okay?
When a person needs that, yeah.
And again, that's the medical need, not...
But most of the people that are taking Ensure, it's because the doctor told them they need calories.
Right, no one's drinking it.
I don't find people drinking it like a soft drink. It's not, a person who's got Ensure, an insured delivery by the front door.
Right.
It's a person who's sick. It's a person who's got to build up. Those people shouldn't be thinking about kidneys. Okay. They should be thinking about building up. And then the final is a diabetic in terms of grape juice. So the emphasis is that a diabetic, the smallest shiur is Rav Moshe shiur, who holds 2.9 ounces, is Revius. It's a very small shiur. Roiv kais of that is 1.5 ounces. So even a diabetic could drink 1.5 ounces of light grape juice, the low-calorie grape juice, and that's come out nothing, and he could drink it. Again, generally we see drinking roiv kais right away, but b'shas adchak, we would also say in a kedei achilas pras for shtia. That means we would give it the 2 to 4 minutes also. So a diabetic sipping 1.5 ounces out of a 2.9 cup, I think they could... There's endocrinologists that say I'm wrong, so I'm wrong. But again, I think that, Kal grape juice, 1.5 ounces out of a 3-ounce cup, it could be done. And if it can't be done, so even though we don't have clarity today as to what is Chamar Medina, we don't really know accurately, but yeah, so tea, coffee, and if that can't be done, because so then the person could just have somebody be Moitziim. That's the last resort, because we want people to drink the Dalet Kaisis on the order that Chazal made it, for Kiddush, for Agoda, for Berachas Hamazon, and for Hallel. But and it has to also be understood. A lot of people make this mistake. Older people who are they're at a long seder and they lose energy. So after Berachas Hamazon, they just drink the 4th cup and they go up. And really, you can't make a bracha on that. It has to be for Hallel. So that's a bracha levatala, and they're just for no reason taking those calories, and it's not necessary or even permissible. So that's that. And then matzah, the shiur of matzah, again, it's hard to define.
Can I just ask you for a second? What's the lechachila? Let's say not Friday night. Let's say on a year like this year. What's the lechachila for a healthy person to take on the shiur for yayin? what should we aim for? Could we somehow Moshe?
4 or 5 ounces.
4 ounces is what the preference would be?
Yeah, I do 5 ounces. I don't do more.
And that's Rovkos, Kolko, or the.
I try to finish it, but yeah, Rav Kais is good. I'm saying Rav Kais.
Okay,
is
but
good.
anyone that has any issues, drop down to the minimum share. Okay, sorry.
Right.
Okay.
No.
And matzah.
And matzah, again, it's very hard to give a shiur because it's totally in thickness and weight. But for the most part, my father used to say that half of a machine matzah is a kazayas, and b'shas chak, a third of a big matzah is a kazayas, a robust third. You would also like a half, but a robust third is a kazayas. Those are the small kazayas.
Are we going to be mechalek between thickness of the matzahs?
Yeah, I said it's very hard to give a shiur because you have some matzahs like brisk and satmar matzahs are very thin, and you have bells that are very thick. Obviously, the thickness makes a difference, and if it's thicker, you would have less of a shiur. You would need less.
Okay, so again, l'chachila should be half, and b'diavad a third.
Yeah.
Okay. Is there any? Let's say someone's in the hospital with someone that's sick, or let's say they are the chol themselves. Is there any recommendation of what they should do to mitigate? Should they gut magid? What's the baseline chiyuv just to get through the seder and try to do kind of mitzvahs?
Look, there were Rishonim that held that the Dalit Kaisis could be just not ala seder, but the Manishtana and Chelik of the Agoda, they're not going to bench. So how are they going to make that?
Okay. It's not going to get through the Dalit
right,
seder.
Right. They'll have to rely on the Rishonim that without brachas. They'll have to rely on the Rishonim that hold. You could just drink Dalit Kaisis Shalei ala seder.
Okay. Let's say someone's tending to someone that's sick. We're going back to Sukkot. Risham Shein, is there an element of just doing like a bare minimum of the Magid to be stripped out to Manashtan Avdim Adinu and then
it takes 5 minutes to read the whole Agod if you do it like davening. I'm saying it's a whole seder. If you're not performing, a person could do it. A person could do it in a half hour. So even a person who's taking care of a sick, obviously that takes precedence. That's the most important thing. But a seder could be done in there's a nice story about they say it from the Baal Shem Tov where a guy walked in on the first day of Pesach and the Baal Shem lit up and they didn't see him in such an excited state. None of the Chassidim remembered it, and he was just so happy and he didn't himself know why he was so happy, and then he tried to follow where the happiness was coming from. And there was a peasant in the back. And he asked him, what kind of seder did you have? He said, something about your seder. He says, don't ask what kind of seder I had. I'm asking. And he tells him, listen, he says, I'll tell you, but you're going to be sad. He says, I came home, I work so hard. I collect clay and I sell it in Mezhebush. He says, I came home, I was so tired. When my wife set the table, it was just me and her, we're older, and I said Kaddish and I fell asleep, and she couldn't wake me up. At 2 o'clock I woke up and I saw her, and it looked like she cried a lot, and I begged her forgiveness, and I just told her, look, it's 2 o'clock, let's just drink the Dalit Kaisis. And I said to the Rabbeinu Shalom, if you wanted a better seder from me, you would have given me a better livelihood. You would have given me more strength. You wouldn't have made me into such a shmata. I'm drinking so that I should have a better livelihood. I'm drinking because like you took the people out of Egypt, take me out of my gullus. I'm drinking, I thank you that I'm able to drink. And I'm drinking, good night. There was no seder. He fell asleep. And the Baal Shem said that was the nicest thing the Rabban Shalom heard, that night. So, yeah, Rahman Ali, we understand that concept. Person who's taking care of a loved one in the hospital. There's nothing nicer than that. All right. Thank you.
We would like to thank the Rav for joining us and thank everyone here for joining us. And we're going to be sending out Hashem shortly. Kashrus.